Hi, Ivy.
Hi, Dr. Matt.
Very nice to see you again.
You too.
How are you?
I'm okay. I had a little bit of an allergic reaction, I think.
Okay.
I'm not really sure what it was because I didn't know I have any allergies, to be honest.
Okay.
But I went out to dinner a couple of days ago and we had dinner. I'm not really sure what it could have been, to be honest. But within like 30 minutes, I just started to get like hives, like around my mouth, my neck, a little bit on my chest. I don't know, just like overall symptoms of like just feeling sick, runny nose, things like that.
Okay.
And then it lasted I did take some Benadryl, and then I felt better within maybe an hour. So I'm not really sure what it was. I was hoping you can help me.
Okay. Do you have any allergies in the family?
No.
Okay, so no family history of any type of allergies. And you said runny nose, hives.
Mm-hmm.
And where exactly did you have the hives? Was it on
So
the
it
neck?
was around the mouth, neck, chest. It's like super itchy.
And for how long they lasted?
So maybe an hour after I took Benadryl, so about like 2.5 hours after I had dinner.
Any shortness of breath with that?
No.
Okay. Any palpitations or chest pain?
No.
Okay. Did you feel like your throat was closing or you couldn't breathe?
No, not really.
Okay. Any watery eyes?
Yes, watery eyes, runny nose.
And do you remember what you ate that night?
So we went to a sushi place. I had a salad that had mushrooms and seaweed.
Okay.
Probably sesame and soy sauce. I'm not really sure.
So we're definitely going to have to check for sesame allergy. And seaweed, you said.
Soy sauce for
Soy.
sure. Yeah.
And we're going to check for soy as well. Those are the basic allergens that we would like to make sure there is no reaction.
Okay.
Are you taking any medications currently?
No.
Okay. And did you run a fever after?
No.
Okay. And any history of heart problems or endocrine disorders?
No. I did have some swelling as well.
Swelling.
Yeah, I noticed my lips were swelling a little bit.
Okay. So probably you did take Benadryl and that kind of brought it down, and whatever allergic reaction you had now, if you encounter it again, it might be a little bit worse than it was the first time. So it is crucial that we target and find out what you're allergic to so that we can avoid it.
Okay.
Okay, I'm going to put my gloves on and I'll take your vital signs. Okay, and anybody else who was with you that evening, did they have any reactions?
No.
Okay. And is this the first time that you felt anything like this?
Yeah.
Okay. I'll take your blood pressure, so this will go on your arm. Is it okay if I put the hair back? Okay, go ahead and relax. Blood pressure is normal, 118/65. Okay, and I'll listen to your heart. I'm just going to put the hair back as well on both sides. This is going to feel a little bit cold. You can go ahead and relax. Okay, go ahead and take a deep breath in for me. Breathe out. And again. And breathe out. Okay. Take your temperature. This is going to go on your forehead. Okay. Low temperature, 97.3. And this will go on your index finger. Go ahead and breathe normal. I did hear some crackles on your lungs. And heart was normal. Sounds. Okay. Oxygen 99% down around air. Heart rate is 81. Okay. Thank you. Okay, so I would like to start with your throat. Okay. I'm gonna have you give me a big ah. A little bit of redness in the back of your throat. A lot of mucus as well. Are you having any pain?
Mm-hmm.
Okay, tongue is also a little bit swollen. Okay. Has your taste changed?
No.
Okay. So let's go ahead and check that. I'll put a 1 drop on your tongue. I'm gonna need you to tell me what this tastes like.
Pineapple.
Right, and I'd like to check your nose as well. See if there's any swelling. Go ahead and look up for me. Yeah. So I don't know if you'll be able to distinguish the smells that I have, but first I want to check patency. So I'm going to cover one nostril. Can you breathe in, breathe out? Okay. Doesn't seem to be anything obstructed. I have here a few smells. They're very basic. Can you please close your eyes? And tell me what this smells like.
Lavender. Not really sure that smells like anything.
Okay. Go ahead and take
Just taste bad.
breathe one more time.
I cannot really recognize that.
Okay, no problem. So a little bit of swelling that I saw in the back of the throat, also increased mucus secretion in the throat and mouth, redness, and I did see a little bit of redness in your nose as well. So the smell test was a little bit off. The first one was lavender, but then the one on the right side you were not able to identify. And when we did right and left, also you were not able to identify those. So your smell is a little bit compromised. Okay, I will do two tests, one in the nose and one in the mouth. We'll take a swab and we'll send it to the lab to see if there is any infection that could be intercepted by this allergy reaction that you had. Okay, so this is going to go inside your mouth, around your cheeks. It's going to feel like a tickle. Okay. I'm going to send this to the lab. And this one is going to go in the nose. Okay, this is going to feel like a tickle as well. Okay. Okay, I'm gonna have you lay down. Okay. And I will take a look at your ears and then we'll do an allergy test on the back. Okay? Okay. Okay, Ivy, I'm going to take a look at your ears as well. I'm noticing you are missing an earring.
Yeah, I just took it off because it was just hurting.
Okay. Alright, any pain here?
No.
Okay. I'm going to do a hearing test. Can you please tell me when you don't hear the sound anymore?
No. No.
Okay, go ahead and tell me which position here is louder. Position number 1 or 2?
2.
Position number 1 or 2?
2.
Okay. Position number 1 or 2?
1.
Position number 1 or 2?
1.
Okay. And I'll also do a sensitivity test. I'll touch you with a sharp object and a dull object. This is what dull is going to feel like. And this is what sharp is going to feel like.
Dull. Sharp. Sharp. Dull. 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 Dull.
Okay.
Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull. No.
Okay. Go ahead and tell me if you feel this on the left or right.
Right. Left.
Okay. And go ahead and turn your head this way. I'm just going to take a look inside your ear. Check your ear canal for any accidents and tympanic membrane. Just a little bit of redness and earwax. We could go ahead and clean that to make sure that there is no inflammation. Okay. Almost same amount of earwax, maybe just a little bit more on the right side. And there's some inflammation here as well on the canal. Okay. I'm gonna have you turn on your belly now, and I'll do an allergy test. I'm noticing you have some purple, pinkish, red circles on your upper back.
Yeah, I had some cupping therapy.
Okay. Then I think it's okay to go just a little bit lower than that, and it looks like there's enough space for us to conduct our allergy test. First, I would like to clean the site. Okay. I'll do a sensory exam to make sure that it's the right spot for this type of testing. I'm going to touch it with a sharp object. This is what sharp is going to feel like. And also a dull object. Can you please tell me if it feels sharp or dull?
Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. 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 Dull. Dull.
Okay, we're going to let that air dry. I'll be making some markings on your back. So first we're going to start with a positive and negative. And also I have 4 allergens that I would like to test today. Okay, and I'm going to clean that up, so don't worry about it. Okay, this is a very safe procedure. Even if you do turn out to be allergic to one of these samples, we are ready to take care of that. After we apply the solution, we're going to leave it on for a few minutes. Usually within 10 minutes, we are definitely able to notice an allergic reaction. Sometimes it could be a little bit sooner. Okay, and we do need 2 more. Okay. Now we're going to wait for about 10 minutes, and then we're going to take some measurements, reassess, and see exactly what kind of reaction we have. I'll be right back. Okay, I'm going to take a few measurements to check exactly the level of inflammation. Okay. Okay. Right. I'm going to apply some, no. I'm going to clean the site, and we're going to discuss the results. You're going to notice a little bit of redness for the next 48 hours. Results did come back positive to one of the allergens, which is really a reassuring thing that we found what you're allergic to. I'm going to go ahead and prescribe an epinephrine pen, and I will make sure that you understand and you leave the office informed with the next steps. Being prepared in a case of emergency is very important, and it'll help you feel a lot better. I'm going to apply a cortisone cream in the spots that you did develop the rash. It's going to help to lower the inflammation. You're not going to have a systemic anti-inflammatory response. Also no anaphylactic shock. This is going to help with itchiness. Okay, I'm gonna have you sit back on the table and we'll discuss the results. Okay, Ivy, I do have good news and bad news. The good news is that we did find what you're allergic to. The bad news is that it's going to be kind of an adjustment for you. You'll have a lot of support from us, and we'll show you, throughout the whole journey how to use the EpiPen in case of an emergency, and how to avoid the allergen in your daily activities.
Okay.
You are allergic to sesame seeds, so anything that contains sesame is definitely a no for you. Just be aware of, even if you have it in the house, to remove it. And definitely sushi has a lot of sesame. Okay, so I will prescribe the EpiPen, and I have here the trainer EpiPen. I'm gonna ask the nurse to come in and show you how to do it.
Okay.
Do you have any questions for me?
No, I think I'm good.
Okay.
Yeah, I would like to learn how to use it.
Always have Benadryl inside the house. Sometimes it's not necessary to use the EpiPen. You actually use it in case of an emergency. If your airway starts to swell or to close up, you feel like your tongue is getting bigger, your lips are getting bigger. So anything that is very close to the airway, then that's when we would like to use that.
Okay.
Otherwise, if it's just hives, itchiness and stuff like that, some more skin related, then it's okay to start with a dose of Benadryl, increase it, and then if that doesn't work, then you can either give us a call or use the EpiPen.
Okay.
All right. Okay, so I hope everything, settles down for you, and if you have any questions, go ahead and give us a call.
Okay, for sure. Thank you.